On behalf of the House Democratic Caucus, I want to thank all the members of the press corps for being here today as the end of the 16th week of the legislative session is upon us. This is a week that was filled with numerous frustrations and challenges. I'll be honest with you, I was proud of my team. The members of the House Democratic Caucus stood firm this week as we tried to protect and defend the most vulnerable in our society. We've got 1 in 5 of our citizens in this state without any health insurance. We've got folks in this state, hundreds of thousands of which rely on things like the Earned Income Tax Credit just to pay for milk and necessities. And what you saw this week was an effort by my caucus to protect those folks across the board. But unfortunately, it was a dark and dismal week for many of those in the state who can least afford cuts to their services, cuts to their funding, cuts to their schools, and increases in taxes. What you saw this week was an effort to balance the budget in the state of Oklahoma on the backs of the least among us. The Republicans in charge decided that they wanted to balance a portion of the $1.3 billion budget hole that they helped create with their billions of dollars in tax credits and exemptions, with their $1 billion in income tax cuts, and their hundreds of millions of dollars in gross production tax giveaways. They chose, instead of rolling those issues back, instead of rolling those taxes back and truly finding significant ways to balance the budget, that they took $200 or $300 out of the pockets of single mothers who make $20,000 a year working at Wal-Mart. It was a dark, dark week. We say all the time, you hear people up here all the time tell us that we want to be a pro-family state. Families in Oklahoma this week suffered because of what the majority party decided to do to balance their budget. And then they try to tell us that somehow because we won't vote for a cigarette tax increase on what was predominantly poor individuals in Oklahoma, that somehow we aren't the ones supporting health care in Oklahoma. We want to make it very clear to every hospital administrator, to every doctor, to every nursing home administrator, to every person in the state of Oklahoma who has someone in a nursing home, understand the budget cuts that have come to the Health Care Authority and that have come to the hospitals and nursing homes over the last 6 years, they came at a time in which the price of oil was $100 a barrel. They came at a time in which 1 in 5 of our citizens had no health insurance, and our caucus stood up to fight against those tax cuts, stood up to fight against the gross production tax cuts, stood up to fight to bring our federal dollars home, to cover those uninsured so that our families, our hospitals, our nursing homes could have the resources that they need. And each and every year, the folks in charge who now point their finger at us and say we need to raise cigarette taxes, and without them, the whole world is coming to an end. It was their obstruction that prevented those important federal resources from coming in. Today, this week, the folks in charge are leaving $900 million on the table. $900 million of our federal tax dollars that our citizens have already spent are waiting to be brought back to the state of Oklahoma, and it only takes 16 Republicans in the state Senate to get it done. Understand, there is a bipartisan majority in the House of Representatives, we believe, to bring our federal dollars home. And not only to bring those $900 million home, but also to find a way to increase the cigarette tax if that's what the governor chooses to do. She rolled out her health care plan and said we want to expand Insure Oklahoma and we want to pay for it with a cigarette tax. Our caucus stands united with the governor. The Senate President Pro Tem Brian Bingman and the Speaker of the House just a few weeks ago stood before this very press corps and said that they support the governor's plan of expanding Insure Oklahoma through the Medicaid rebalancing plan, and they were worried that they couldn't get the cigarette tax. Well, now they know they can get it if they simply stand by their original word and expand Insure Oklahoma and bring those $900 million back to us, but they have refused to do it. And who has refused to do it? Not the House Democrats, not Senate Democrats. We are in a medical crisis and a health care crisis in Oklahoma right now because of the fiscal decisions that have been made in the last 6 years, and more importantly, because 16 of 39 Senate Republicans won't stand up and do the right thing. All it takes, every hospital administrator, every person out there who's concerned about health care in Oklahoma, they need to contact 39 Senate Republicans and find 16 of them willing to stand up and make the right vote to bring our federal dollars home, just like Senator Bingman, Speaker Hickman, and Governor Fallin wanted them to do. And if they'll do that this week, if they'll do it today, tomorrow, if they'll do it by beginning of next week, to find a way to bring those 16 Republicans to their senses, to vote to bring our federal dollars home, then we'll bring $900 million from Washington in, and we'll have $180 million in a tax increase on cigarettes to combine to help protect health care in Oklahoma, and not only to protect it this year as the one-time Band-Aid would be for the cigarette tax, but to protect them for years to come. That's where we are. And so we are indignant and frustrated that those people in charge who have helped create this mess and have overburdened our hospitals for the last 6 years would dare stand up and say that because we won't vote for a $1.50 cigarette tax increase, health care in Oklahoma is going to crumble. Health care's been crumbling because of what they've done. And then what do they do to sort of put the icing on top of the cake? They say that instead of finding a way to bring those $900 million home, they'd rather take $230 out of the pockets of working poor folks in Oklahoma. They eliminated the earned income tax credit, a credit that was signed by Governor Keating at the state level and signed by President Ronald Reagan at the federal level. They eliminated the earned income tax credit for working families. These are not lazy people who don't have jobs. These are families that work and have children. Over 200,000 of them, thousands in each and every district in the state of Oklahoma, are going to suffer. They're going to pay more in taxes because of what the folks in charge decided to do this year to balance their budget. Instead of going after gross production taxes, instead of rolling back the income tax cut, they chose to take money out of the pockets of the hardworking poor in Oklahoma. It is a dark week. Health care is on the verge of bankruptcy, and now they've decided to take those who are individually on the verge of bankruptcy and push them closer to it. We have said all along we're not expanding Obamacare in Oklahoma. We have asked, for the longest time, we wanted to expand Medicaid. That's what we said for 6 years. But the Republicans said no. And so the governor, the Senate President Pro Tem Brian Bingman, and the Speaker of the House stood together at a press conference not too many weeks ago and said, we have a new plan. We're going to do Medicaid rebalancing and bring our federal dollars home to expand Insure Oklahoma. The House Democrats stand with them on that position. We've stood there all along. We said we are willing to give up Medicaid expansion to expand Insure Oklahoma. We support you, Governor, and what you're trying to do, and we support the way you want to pay for it. They've abandoned their plan, and because of that, they're leaving $900 million on the table. Healthcare in Oklahoma hangs in the balance on the hands of 16 of 39 Senate Republicans. If they'll stand up and support the governor's plan on healthcare, we'll stand with them and get it done and bring $900 million home and find a way to get the cigarette tax done to bring that $180 million in. It is fundamentally disingenuous for the Speaker of the House to stand up and say, there is no plan B. If you don't support a cigarette tax increase, nursing homes are going to close. We have seen and visited with the chairman of appropriations in the House of Representatives. He has said openly in a joint committee on appropriations that there is no cigarette tax built into his budget, and yet he has $130 million going to the Health Care Authority and to mental health. So for the Speaker, anybody else to stand up and say without the cigarette tax, nursing homes are going to close is a flat-out lie. They know it. It's not in their budget. They do not have cuts in their budget without the cigarette tax. They've actually got more money in their budget without the cigarette tax. They know it. It's a scare tactic to try to divert blame from where it really lies. And right now, that is in the hands of 16 Senate Republicans who won't stand up and support the governor's health care plan. We've seen some tentative budget that has options 1 through 5. We just looked at them this morning that we haven't put together, that the Senate and House Republicans have put together. And in the first 3 options, for the record, the Health Care Authority gets a 3% increase. 3% increase in what we've seen. And at no point in those 5 options does the Health Care Authority receive any cuts whatsoever. I think the last option 5 is about a 0.75% increase. And so things are going to be difficult for a lot of groups. I'm certain of that. You're looking at education cuts. You're looking at potential cuts to roads and bridges and veterans facilities. Because they refuse to address the big issues, they're sort of nibbling around the edges, taking $230 away from poor folks instead of going after the $400 million they give away to the oil and gas industry. I think that you'll see some cuts mitigated, but on the whole, many of them are going to be unavoidable. Remember this, for all of those folks in hospitals around the state, 7 of them have filed bankruptcy. And they filed bankruptcy before anybody ever talked about a $1.50 cigarette tax increase. They filed for bankruptcy because 200,000 people in Oklahoma have no health insurance. And a $1.50 increase in the cigarette tax won't cover one of those 200,000 uninsured. Not one. But the governor's health care plan will, and we support it. Bingman said he supported it. Hickman said he supported it. If they'll stand up and stand by their own leadership, it only takes 16 of the 39 because every Democrat in the state Senate is willing to stand up and do the right thing. Every Democrat in the state House is willing to stand up and support the governor's plan and her way to pay for it. The only people who are standing in the way from bringing $900 million home and covering over 200,000 people in Oklahoma aren't Democrats in the state legislature. There's 16 Republicans in the state Senate. If they don't come to their senses and support the governor's plan that they said just a few weeks ago that they support, then you're going to continue to have uncompensated care at a rate of $600 million a year being given out by our hospitals. You're going to continue to have 200,000 people in Oklahoma without any health insurance, and you're going to continue to have hospitals go bankrupt. The $1.50 cigarette tax increase is only to prevent provider rate cuts right now. It does nothing to cover uncompensated care that the hospitals currently give away. Not $1 goes to uncompensated care. And if you're going to protect hospitals in rural Oklahoma, you got to address uncompensated care. The governor's plan does it. That's why our caucus supports it. It is unbelievable that the Senate Republicans, who just a few weeks ago said that they would support the governor's health care plan, have now abdicated their responsibility because they're afraid of Americans for Prosperity and the Oklahoma Council for Public Affairs. At some point, if they're more worried about saving their jobs than they are saving their hospitals, that's on their head. What we're asking for the public to do is to contact their Republican senators and tell them to support Medicaid rebalancing. If they'll do that, expanding Insure Oklahoma in particular, if they will expand Insure Oklahoma, not Medicaid, our plan that we've adopted via the governor's plan doesn't put one new person on the Medicaid rolls. Not one. We continue to try to find a way to come together. But they know full well what we have said is you've got to find a way to bring those federal dollars home. You've got to find a way to reverse the income tax cuts that help put us here. You're not going to simply sit there and say, you're not going to put a gun to our head and say you've got to vote for a $1.50 cigarette tax increase and leave 200,000 people without any health insurance. That is an unpalatable situation. Our caucus has said all along that you cannot fix the systematic problem facing our budget by bonding the budget. Taking out more debt will not solve the problem. We have a $1.3 billion hole in the state of Oklahoma today, in part because of one-time gimmicks, like taking out hundreds of millions of dollars worth of bonds to solve the problem today, and then it blows a huge hole in next year's budget. We need recurring revenue. Recurring revenue as in gross production tax revenue. Recurring revenue as in income tax revenue. They have reduced the recurring revenue sources in the state of Oklahoma dramatically over the last 6 years. We're trying to get them to put them back on the table. It was a do-nothing session up until about the last week and a half, and now it's just a dark and depressing session as they continue to try to raise taxes on poor families to balance their $1.3 billion hole instead of rolling back the tax giveaways that they gave to their wealthy special interests in the state. I know that the speaker offered up about 60 different sales taxes increases. He wanted to have a death tax on funerals. He wanted to have a tax on hunters. Wanted to have a tax on Netflix. A lot of those are pretty unpopular, I believe, and so that was thrown out and then was told it was an inadvertent distribution of it. We've not seen it rolled back out, and I would hope at this point that the speaker would rather look at rolling back the income tax cut or looking at the $400 million gross production tax giveaway and say, let's look at reversing the fiscally irresponsible decisions that put us here in order to balance the budget instead of finding a new way to tax working families.